Hey, it's Dr. Sara Gottfried, and I want to talk today about some statistics related to how women die. Like, what should we be concerned about? As you may know, women are really scared about breast cancer, and I totally get that. But sometimes it's at the expense of an even greater killer, which is cardiovascular disease. So 1 in 5 women in the US die of cardiovascular disease. And I just feel like I can't say that enough, because the number of us who die of cardiovascular disease is 7 to 10 times more than the number who die from breast cancer. Now, part of that is due to the advances that have come in diagnosing breast cancer earlier and having better survival. And it also relates to the fact that we haven't really had improvements or much beyond modest gains when it comes to cardiovascular mortality. But one factor that I think is really important is that women are dying of cardiovascular disease. They're developing cardiovascular disease at much younger ages than ever before. And so I wanted to share with you a statistic that came out recently. I talked about this in my book, Brain Body Diet. Despite overall reduction in cardiovascular mortality in the US, hospital admission with acute myocardial infarction is on the rise in women aged 35 to 54. I think that's a big deal. It's related to a number of different factors. In fact, there are 400 risk factors now for cardiovascular disease, not the standard 5 risk factors that you probably have heard of, but 400. And I just think it's important for all of us to be aware of our personal risk of cardiovascular disease. One last thing I want to say is that there's not just sex differences in how we develop and the symptoms that we have with cardiovascular disease. Heart attack is a good example because women tend to have more subtle symptoms. We don't have, sudden substernal chest pain like an elephant is sitting on your chest that radiates down your left arm. We tend to have neck pain or jaw pain, or I have a patient that I'm writing up a case for who had syncope. She fainted. That was her symptom of coronary artery disease and having a myocardial infarction. So one of the gender differences is that women are less likely to get early medical care when they have symptoms of cardiovascular disease. And it's not by a small amount. It's actually 10 to 25% lower chance of early medical care. So I hope you'll join me in trying to raise awareness about cardiovascular disease. It's not that we want to study it or pay attention to it at the expense of breast cancer. We just want to keep our eyes on both of them. I think one of the reasons why my patients are so concerned about breast cancer is because of what's known as an availability bias, which means we see our breasts every day. And it's just a reminder, oh my gosh, what are those guys doing now that I'm done with breastfeeding? Like, are they little cancer producing factories? I think that runs through the head of at least my head, maybe your head too, I wonder. And when it comes to the heart and the cardiovascular system, like the vascular tree of your body, we don't see it. And so it's a little more abstract. I think that's part of the story here. But if you have ideas about how to raise awareness, how to make paying attention to the heart and all of those lifestyle and dietary and, all those lifestyle tweaks that you can make that help to reduce your risk of cardiovascular disease, because I really think of cardiovascular disease as primarily a lifestyle medicine problem, I'd like to hear about them. So let me know below, and I'll be reading through your comments. Thanks for joining me today, and help me with raising awareness about cardiovascular disease. Thanks.